Welcome to Friday's coverage of COVID-19. Authorities have disclosed their public safety guidelines for the next 2 weeks, starting from Monday, to better prevent a possible resurgence in cases following next week's Chuseok holiday here in Korea. And we are poised to delve into those details. But first, here is our Kwon-soa with the latest numbers on the pandemic for this Friday. So let's begin with the latest on the local front. I understand we're ending the work week with little change in daily numbers.
Yes, Sunny, it looks like it's taking some time for the situation to stabilize and for daily infections to drop and remain in the double digits. And as we can see with Friday's caseload here at 114, for the past 3 days, the numbers were in the triple digits, while before we had also 3 days of double digits for 3 consecutive days. And as these fluctuations continue, the government announced its special virus prevention measures, which will be in effect from September 28th to October 11th. And that means basically level 2 social distancing measures will prevail, but they have been tightened at high-risk facilities and loosened at others. But our Kim Da-mi will go into the details of that in a bit. Now, officials continue to call on citizens to refrain from traveling around the country during the Chuseok holiday. As you can see, most of the country is still being affected by the virus, especially the metropolitan region, with over 80 cases reported this Friday here, including 57 in Seoul and 27 in Gyeonggi-do province. Meanwhile, this Friday, 95 cases were local infections, while 19 were imported cases. And with that, the total figure now stands at 23,455, and the death toll is at 395, with some 128 people currently in serious or critical condition. But also almost 21,000 people have now made a full recovery of the coronavirus here in the country. And now let's turn to the international front. We have over 300,000 new cases in just a day, and it looks like the death toll is slowly approaching a worrisome milestone of 1 million that could happen over the weekend or next week. And we have some 23.9 million recoveries. Now let's take a look at the countries with major outbreaks here. The US at almost 7.2 million and 5.8 million in India, which is seeing the fastest rise in cases. And over in Spain, this country has surpassed the 700,000 mark, and Argentina has surpassed South Africa in total cases. And if we go over to France, a new record high of daily cases were reported there at over 16,000 in just 24 hours. And that is why this country, the government has announced more restrictions regarding closures at restaurants and bars, and that goes for many European countries which are dealing with resurgences. And those are the updates I have for now, but I'll be back with more after the government briefing. Back to you, Sunny.
Right, so thank you for that. I'll see you back at the desk. Back on the local front, as I mentioned at the start of the program, the government has disclosed a fresh set of do's and don'ts ahead of the Chuseok holiday to better prevent a resurgence in cases. I have our Kim Da-mi here in the studio with me with details on that. Welcome, Da-mi.
Good afternoon, Sunny.
Right, Da-mi, let's start with the details then. Tell us about the new guidelines.
So level 2 social distancing will remain in place for the upcoming Chuseok holiday to prevent the further spread of the virus. And the government says strengthened guidelines will be in effect to minimize the risk of associated with the large movement of people. Let's take a listen.
During the holidays, our disease control and healthcare systems will be placed on an emergency footing. To ensure smooth testing, screening centers will be operating normally in all regions. The 2-week span from September 28th to October 11th will be designated as a special disease containment period, where enhanced social distancing measures will be in effect.
So that means no gatherings of more than 50 people indoors and more than 100 outdoors. That applies to all parties and gatherings at small villages, which is a common sight during the Chuseok holiday. In addition, all sporting events will continue to be held without spectators. For the metropolitan area, 11 high-risk facilities, including singing rooms and buffet restaurants, will have to close. Regular restaurants, bakeries, and highway rest areas with more than 20 seats must enforce 1 meter social distances. If abiding by these rules is difficult, they have to keep one empty seat or table between others or install partitions. But in non-metropolitan areas, 5 high-risk facilities will not be allowed to operate. So that includes bars and other types of establishments that serve alcohol. Church gatherings and eating at churches in the Greater Seoul area will be prohibited. So technically, all services will have to be held online. But indoor public facilities will be in operation as long as masks are worn and the number of visitors are limited. And all PC rooms across the country can operate, and users can also eat there as long as users keep an empty seat next to them. The same applies to theaters and concert halls in the metropolitan region, and visitors to amusement parks and water parks will have to reserve their tickets in advance online. They'll have to keep the number of visitors to 50% of their capacity. In fact, many people are booking hotel rooms and other accommodations to spend their holidays there. Almost 95% and over 50% of all hotel rooms are now booked in Gangwon-do province and Jeju Island, respectively, for the Chuseok period. With these 2 regions being the country's most popular tourist destinations, preventive measures will be stricter than ever during the holiday. Enhanced disease control measures will be in effect from September 26 to October 4th for Jeju Island. So during that period, no parties and other large gatherings will be allowed at guest houses or restaurants. Those with a body temperature of 37.5 degrees Celsius or above must get tested and isolate themselves.
Right, Tammy, quite a list of guidelines to follow.
Right.
Meanwhile, efforts to ensure the second set of relief funds, hopefully that they will reach people before the Chuseok holiday, are underway, I hear. Tell us more.
Exactly. So the government plans to execute about 70% of the 4th extra budget before the upcoming Chuseok holiday. And that's to provide financial relief to those hit hardest by the COVID-19 pandemic.
Of the 7.8 trillion won budget, 70% will be executed before the Chuseok holiday, so I believe citizens will feel relieved.
So starting yesterday, payments amounting to roughly $430 have been handed out to non-permanent workers and freelancers, numbering some 500,000 individuals. Financial aid will also be provided to 2.4 million small business owners before Chuseok on a first-come, first-served basis. So applications must be submitted before 5 p.m. next Monday in order to get the funds before Chuseok, but those eligible can still apply anytime to get the funds later. So for small business owners who didn't face quarantine restrictions, a lump sum of about $850 will be given to those who qualify. But those who had to shorten their operating hours will get around $1,290 regardless of their annual revenue. And for those business owners who've been forced to suspend their operations entirely will be given about $1,720. Text messages were sent to all eligible small business owners on Wednesday, and they'll be able to apply online through a web link included in the text message. The procedure has been simplified, and they only need to provide their business registration number, verify their personal information, and enter their bank account details. The funds will be transferred to their account as early as the following day. Also, by next Tuesday, parents with young children will be provided with $107 per child under the age of 14. In addition, the government will start distributing about $430 on Tuesday to low-income earners and young job seekers who are currently out of work.
Right, and hopefully that will offer them some form of relief then. All right, Tammy, thank you very much for that. I'll see you again soon.
Sure, my pleasure.
Well, it's a little after 2 in the afternoon here in Korea, and we turn now to the regular government briefing on COVID-19 here in this part of the world. And while we wait for it to commence, let's take a look again at the guidelines disclosed by the government earlier in the day with regard to the safety measures for the next 2 weeks, starting from next Monday until the 11th of October. Now, travel to hometowns, travel to family tombs, and travel to tourist sites are being advised against, with toll fees in place to further discourage those planning to use their private automobiles. What's more, on-site dining and drinking at establishments at rest stops, that is, on the highways, will not be possible because eateries will only be able to offer takeout services. Now, while such long-distance movement is being discouraged, short trips to public facilities, including museums and libraries, like our Kim Dami mentioned, are possible, as these venues will be open to the public, with, of course, a limit on the number of visitors. Water parks and amusement parks will operate as based on a reservation system to better control crowds. Now, in essence, level 2 social distancing remains in place for the entire country until the 11th of October. And having said that, perhaps we can take a look at those guidelines while we wait for the briefing to commence. Gatherings of more than 50 indoors and 100 outdoors remain banned. I understand the briefing is about to start. We'll come back to you afterwards.
We will now begin our regular briefing, and it will be followed by a briefing separately on the vaccine supply as well. Today we have Commissioner Chung Eun-kyung for the briefing, and first of all, we will be briefing you on the COVID-19 response, and this will be followed immediately by the influenza flu shot vaccine, and as well as the research analysis updates. And we will receive Q&A on the vaccines first. So first off, we will begin our COVID-19 response briefing by Commissioner Chung Eun-kyung. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 25th, Friday, we have 95 new local infections and a total of 19 new imported cases. The total caseload now stands at 23,455. Currently, we have 2,082 people in quarantine undergoing treatment and 128 patients with severe or critical conditions. Unfortunately, we had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. First of all, let us now look at the details on the updates on domestic infections. In Tobongo district, we have the Yemaru Daycare Center, and we had the first index case on the 22nd of September. We carried out in-depth analysis, and a total of 18 people have been confirmed to date, and 9 of them were the users, and 6 were the staff members, and 3 were their family members. And in Sarang-Namu Daycare Center in the Gwanak-gu district in Seoul, we have 6 cases being confirmed. 1 was the child, and 4 were the staff members. And in relation to the Bible study group in Dongdaemun-gu district, we have 5 additional cases, and a total of 18 have been confirmed to date. As reported earlier, we also have a nursery daycare center in Gangseogu district. We have found that the index case has went to the Bible study group meeting at the Dongdaemun-gu district, and we also have reclassified the name of the case, the title of the case. And in relation to a music public academy in Gyeonggi-do province, we also have additional cases, and 7 of them were the students. And we have 19 new imported cases, and of them, 6 have been confirmed on points of entry, while 13 have been reported on self-quarantine, and 16 of them were foreign nationals. And as for the countries of origin, we have 8 from Uzbekistan, 3 from the Philippines, and 2 from the U.S. And the quarantine officials currently note that we have seen some increase in the number of cluster infections and cases due to false testimonies of the infections and contacts, and therefore we ask you to provide truthful information as well. And in the initial stages of the epidemiological investigation, we have found that this confirmed case has provided false information on the fact that he or she has visited the door-to-door sales facilities, and later it has spread to other chains of transmissions through the office spaces and family gatherings as well. And this was the case of the cases seen at major office buildings, as well as a family gathering in the Ulsan city, and respectively these cases had 25 and 30 cases of accumulated cases. And this has led to the testing of numerous people, and it also led to the closure of self-employed businesses, and there were also people who were not able to go go to work, and there were also social loss and costs that were incurred. And therefore, in accordance to the legal principles, we are subjecting these persons to penalties and fees. And unfortunately, we have 64 cases which are under that have been reported, and we have 18 cases that are being investigated right now, and 4 of them have been arrested. And right now, at a time when we do not have an effective therapeutics or vaccine against the virus, it is very important for us to identify the contacts at early pace and also put them in self-quarantine. So we ask for your consideration and understanding going forward. And we believe that the many people are experiencing a prolonged fatigue against the virus, and we are also providing a new campaign to discover new role models and the exemplary models of people abiding by the quarantine measures. So we are asking people to voluntarily take part in our quarantine culture, and this is also in part of this we have on Instagram a campaign to have a contest on the receiving of the title of such campaign, and we ask for your participation, and we sincerely hope that this culture can spread nationwide. And next week we have the Chuseok holiday, and we believe that this weekend will be actually the beginning points of this week-long weekend, and we ask the public to refrain from going to their hometowns or visiting their relatives and rather stay home safe and sound. And as we experience in late April and early May, as well as in the summer holidays, we saw a resurgence in the number of confirmed cases where we had a mass movement of people around the country. Therefore, during the Chuseok holiday, we ask you to refrain from making non-essential visits outdoors and also refrain from visiting your hometowns. And as the senior citizens are prone to infections, we ask you to refrain from visiting them in person. Rather, talk to them via phone calls and video conference means. And we also would like to note that we are carrying out quarantine measures, and we ask for the public to carry out quarantine measures at all places. And when you are on the road, please utilize your private automobiles, and please utilize mobile or online ticket reservations when you are visiting tourist destinations, and also pack snacks in advance so that you can minimize the time of stay at the rest spots. And when you are visiting your relatives at hometowns, please wear your face mask at all times and wash your hands at all times as well. And this should be abided by, especially when you visit senior citizens. And before and after eating, please wear your face mask, and please refrain from engaging in dialogue when you consume food. And when you have the ancestral ceremonies, please limit the number of people. And next, we will have some updates on the influenza vaccines. First of all, before the briefing, we would like to note that we have the retail and the distributions of the vaccines which have been put on free vaccine as a part of the influenza vaccine program. And we would like to apologize, first of all, for the inconveniences that we have resulted in, and we will make sure to address the situation as quickly as possible. As for the procedures of the supply of the vaccines, here are some updates. Our agency will continuously cooperate with the Ministry of Food and Drug Safety, and we are conducting our research and analysis on the supply of these influenza vaccine dosages. And we have a pan-government team, and we have carried out an on-site inspection on the company, and we have been looking at the inventory there as well as their process of the deliveries and retail as well. And we would like to note that all of the amount that have been put on the retails and which have been subject to the problems of the storage, we would like to note that they were amounted to 5 million out of about 15 million that have been manufactured by them, and they have been distributed to about 265 public health centers, and they have been transported via the cold chain trucks. And we have found during our investigations that this company, we have focused and identified whether this cold chain system was maintained and managed. And as a result, we have seen that the storage inventory had the proper temperature, and at the trucks they had the sensor system for the temperature, and at each of the vehicles and all of the vehicles had the logs on the number on the amount of the temperature, and we are also analyzing this as well, and we are also checking whether they have been abided by these mandatory measures, and we have not yet reached a conclusion as of yet as for the analysis and investigation, which will be provided going forward after we conduct and complete the investigation. And we have also confirmed that these 1-ton truck vaccines have led to the vaccines being exposed to room temperature on the roads, and therefore we are looking into the details as for this matter. And the Ministry of Food and Drug Safety currently notes that there could be a possibility of the vaccine doses that have been exposed to the room temperature, which is not the appropriate temperature, and we are conducting the quality assessment testing right now. And the ministry currently, in order to identify the efficacy of the vaccines, they are carrying out the testings, related testings as well, and they are also taking into account the safety testings as well, including the side effects, and the period of testing will take about 2 weeks. And primarily, we will be testing of the vaccines that have been exposed to room temperature, which amount to 5 cities and 5 areas. And we will be analyzing the investigations, and we will be also expanding the scope of the testing, so going further. And the ministry also notes that we would like to look into the logs of and as well as the temperatures of these trucks, and we will be carrying out the safety testings for this vaccines. And as for the testing methods, they also begin from they measure the maximum time of delivery to the health clinic, and also they look at the maximum deviance of the temperatures as well, and these kinds of safety-related testings are carried out. And for your information, according to the testing analysis and assets and the assessment testings that have been carried out before, we have also have test results that they are safe to use when they are exposed to the temperatures of 25 degrees, and they are safe to use when they are exposed to about 2 to 4 weeks. And we continue to note these vaccine doses that have been under question, and we have gathered the experts for their opinions, and we believe that the vaccines, as they are provided and delivered while they are sealed, we have a low possibility for them to lose their efficacy. However, we saw the need for such a testing because they have been reportedly to have been exposed to room temperature. And we also would like to address this matter as follows, and we will be identifying all of the route numbers that have been, these dosages have been distributed to the clinics. And as for the amount of vaccines that have been purchased by the health clinics separately, they will have a separation of these vaccine dosages, and we will also separate these vaccines that have been provided via the government procurement methods. And we will also have notified the doctors as well as the public health centers to refrain from utilizing these vaccines that have been provided through the government procurement means so far. And we have also found that so far 105 people have been vaccinated with the dosage that have been provided through the government procurement. We are looking into their adverse effects. However, no side effects have been reported as of yet. And in relation to the quality test assessment, as well as the in-depth look into these procurement routes, we will be carrying out in-depth analysis, and we will also listen to the experts of the opinions of the experts, and we will also have the experts revisit the conclusions and outcomes of the analysis going forward. And our agency also would like to note that the free flu vaccine program would also be carried out going forward. And as for the children under the age of 12, as well as the pregnancy women, we will be resuming the programs for these people starting from this afternoon. As for these targets, they will be vaccinated through the vaccines that have been firstly separately procured by the medical clinics separately, and they will be able to charge the government for the fees later on. And in order to ensure the safe vaccinations, please utilize the applications that are run by our agency, and please reserve your time of vaccines. And starting from the 26th of September, you will be able to check all of the list of the hospitals that will be stay open during the Chuseok holidays, and we will continue to look into the situation and respond swiftly so that we will ensure a safe vaccination for all. Thank you very much.
Right, that was Chong Young, Commissioner of the KDCA, with quite a bit of information about the flu vaccines here in Korea, right, So?
Right. We know that the government had that plan to provide free vaccines for the seasonal influenza so that we can avoid a twindemic, so resurgences of COVID-19 cases plus simultaneously infections of the influenza. And there were reports that some of the influenza doses, vaccination doses, were during their distribution process were exposed to room temperature, and there have been made analysis so far, and it looks like there has been no conclusion as of yet, but the government is looking into the truck sensor temperatures or the storage inventory temperatures, so to see what went wrong. But in the meantime, the flu vaccination program is going to continue, which means beginning this afternoon, pregnant women can be vaccinated, but of course with the vaccinations that have been separately held at clinics, so that will continue now. But we will have to look into more investigation.
I see. All right, So thank you for that. I'll see you again next week.
See you next week.
Right, the grooming of family graves ahead of Chuseok comes as part of the commemorations of this lunar harvest festival. But this year, authorities are offering to tend the tombs of loved ones as health experts are discouraging public travel to stem the spread of COVID-19. I have our Chon Song-cho up next. Hello, Song-cho.
Good afternoon, Sunny.
Right, Song-cho, now please tell us more about this service.
Yes, first of all, I'm in Hwaengsong, Gangwon-do province, which is about 2-hour drive east from Seoul. And the reason why I'm here is because I wanted to show you guys what the traditional grass cutting ceremony would look like. Well, yes, 5 days from today, Chuseok holiday begins, and as Sunny mentioned, the government has warned the yearly mass migration of people might spike new infections and urged the public to stay home for this year's Chuseok. Then what about Bolcho and other traditional Chuseok rituals? Well, someone needs to visit the ancestors' graves and tidy up the overgrown grass and weeds, and also tidy up the just the surrounding space, right? Well, don't worry, because the ritual is being observed in a different form this year due to COVID-19, and you can actually hire grass cutting agencies to do the job for you. Well, actually, these businesses are said to be really booming these days with a huge increase in demand. Well, actually, there is about 65% increase in businesses this year compared to last year. So as you can see behind me, there are about 3 people who are working as a team mowing the grass. They're using equipment like sickles and string trimmers, any machines and tools basically that are effective at mowing the grass. And you might have noticed that they're all wearing long sleeves and long pants, and including myself. So you might wonder, you might think that maybe they are overly overdressed for the relatively warm weather. But that's because you never know what you're going to run into in the mountain or in the bushes. There might be a snake or mosquitoes or swarm of bees. Well, actually, our producer and cameraman are very inappropriately dressed for the day. They're wearing ankle socks, and they have been complaining that they have been bitten by insects and mosquitoes multiple times while we are here. And what you also don't want to do is run into a beehive and accidentally provoke an attack. So that's why these workers have made sure that there are no things like that, that this space is clear of beehives and wasp nests. And it's also recommended that you wear clothes that are long and thick enough to cover your body and also to protect your skin. But why am I telling you all of this? Because, again, you don't have to do the job yourself. There are professionals who know what they're doing and who can do the job so much better and quicker than you do. So why not use this as an opportunity and make it an excuse for you and your family to just truly enjoy Chuseok and have quality and lovely time with your loved ones comfortably at home. This has been Chun Sung-cho reporting live from Hwaengsong, Gangwon-do Province, and back to you, Sunny, in the studio.
All right, Song-cho, thank you for that coverage.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
국내에서도 일단 재감염 의심 사례에 대한 연구 조사가 진행이 되어서
Come tomorrow, that is Saturday, the world marks 200 days since the global health body declared the coronavirus outbreak a pandemic. And as of this Friday, the global tally of COVID-19 infections stands at over 32 million, and the number of fatalities is nearing 1 million. What's more, the virus is showing no sign of abating. Now, for more on this, I have Dr. Alice Hyun-kyung-tan from Ms. Medi Women's Hospital. Pleasure to have you back, Dr. Tan.
Thank you.
And I also have Professor Lee-Hoon Sang from Yonsei University. Good to see you again, Professor.
Thank you.
And joining our session virtually from the US is Professor Park Ki-bom from Harvard University. Hello again, Professor Park.
Hello.
Professor Lee, we'll start with you then. The fight against the virus, that would be, appears to be a vicious cycle of a surge in cases, a moderate containment, and then again a surge. Now, this unfortunate reality is the case for many countries across the world, including Korea. And speaking of that, how do you assess Korea's response to the pandemic so far?
So far, especially in the earlier phase, I think Korea has done quite well, especially with the open border policy and not much of a lockdown. Korea had been controlling the case down quite much, especially with the additional innovative approaches of use of the drive-through screening center, living and treatment center, and many of the ICT technologies for the contact tracing and others. But some of the recently, I think the Korean government had been somewhat hesitant, even though Korean government had been very quick in their decision and implementing many of the public health measures. Lately, there had been, I think, some of the hesitancy that had created about some of the recent outbreak, and also there had been some of the little bit of a mixed message and mixed communications to the general public about the Korean government's approaches, which may have resulted in some of the recent spike of the little bit of second wave that had happened recently. But I think overall, I think the Korean government is doing quite well, especially with many of the citizens' general strong participations and medical personnel and public health personnel's efforts. So overall, I think Korea is doing well, but I think the Korean government has to be a little bit more consistent and somewhat more affirmative in their actions.
Right, and against that backdrop, Dr. Dang, the daily caseload in Korea remains in triple digits, following a brief drop, of course, earlier this week. Now, authorities believe the upcoming Chuseok holiday will determine the future path of the pandemic here in this part of the world. Do you share this view?
I do. The upcoming Chuseok holiday is critical in terms of where we go from now. I understand that people are stressed, they're tired, they're lonely, they do want to travel, gather, socialize. However, this baseline to which we've gone down after this third wave is much higher than where we were after the Daegu cluster and then after the Itaewon outbreak. Right now, we're dealing with more than 2,000 active cases, and we still have hundreds of cases of unknown epidemiological link. And what this indicates is we have a reservoir. We have a pool of undiagnosed active cases in the community. And if these people all decide to mobilize and travel over the Chuseok holiday, then that risk of seeding the infection throughout our country, that risk is quite high, because what do we do in Chuseok? We gather closely, we eat, we talk, we're not going to be wearing masks when we're in our family settings. And so that risk is really quite high. In terms of what can we do? At this point, I think it's not too late to reconsider travel plans. I think, the travel and hospitality industry, I know they've been hit hard, but I think a very lenient forgiveness policy for people who want to reconsider their plans, maybe postpone or cancel, they should be given refunds, I think. Any gatherings, they should be downsized or postponed if possible. And we should also have the government set very strict, I think, maximum occupancy limits for indoor and outdoor spaces. Not just say, 10 or 50 or go down by half. I mean, that's a little bit non-specific. I would like to see maximum occupancy limits that say how many people per square meter per hour, and just set that limit and kind of have it be a scientifically, based number. We need to find better ways to ventilate our indoor spaces that do not have communication with outdoors. Maybe put in HEPA filters for these spaces. And also, as I mentioned before, the weather right now is great. We need to make better use of our outdoor spaces, because outdoors is safer than indoors. We know that for COVID-19, and we have a lot of parks, sidewalks, a lot of places that we can utilize to decrease the chances of transmission. But I think this is also a good time to look beyond Chuseok, right? We have ways to make buildings fireproof, earthquake-proof. We know how to make buildings child-proof. We need to make our buildings pandemic-proof, not just for this Chuseok holiday and this pandemic, but in the near future. This is something that we're going to have to deal with. And I don't think it makes sense to have any building open beyond 2020 that is not pandemic-proof. It would be foolishness, I think. And so that's something to look at right now.
A very valid point, of course. Professor Park, let's touch upon the situation in the US then. The death toll linked to COVID-19 there has surpassed 200,000. How is the public responding to this sad reality and to containment efforts by authorities in the US?
Yeah, so first let me say hi to my colleague, Dr. Professor Lee. Good to see you. So, South Korea and US, the first cases were seen on the same day in January. The stories could not be any different. In the US, the coronavirus now has killed 200,000 plus 202,000 so far, more than any other country in the world. And right now, around 850 people are dying every day. This is equivalent to 2 fully loaded passenger jets crashing each day. Now, back in March, Drs. Anthony Fauci and Deborah Birx, part of the White House Coronavirus Task Force, they predicted 100,000 to 200,000 Americans could die. And most people probably thought, like me, that surely that won't happen in the richest country in the world with top-notch scientists and medical doctors. The US actually was ranked #1 in the Global Health Security Index, a metric designed to predict the ability to respond to pandemics. But sadly, we have surpassed that number, and the model from the Institute for Health Metrics and Evaluation is now predicting 400,000 deaths by the end of the year. Now, the new cases peaked in July, about 70,000 new cases per day. The number of new cases began to start gradually going down in August, which is good. But now we're seeing an uptick again in September because of the schools reopening. So you ask how the American public feels about this. Many Americans are angry. I am, and we have a good reason to be angry. First, the death toll could have been much less by implementing sound public health measures, even by just a couple of weeks. It's perhaps as much as 50% reduction in mortality if the government had acted earlier. Second, the people are losing jobs at an alarming rate. There was a $2.2 trillion economic stimulus bill that was passed back in March. That ran out of money in August. And now the second round is stuck in politics in this election year. And third, President Trump believes that he deserves an A+ in the way he handled the pandemic. How do you improve on something that you believe you're already excelling in? So the American public is angry, and they will likely express their disapproval in the current administration's handling by voting for a change in leadership in November. I hope so.
Right. Professor Lee, there have been 6 officially documented cases of reinfection across the globe so far, and researchers are actively seeking to better understand them. Could you tell us a bit about the importance of such research into reinfections?
So I think it is now established fact that the reinfection is indeed possible. Having said that, I think it's really important to have more research, and we need to know more about it, because for some of the immune compromised people, maybe that can be a little bit more possible. And also in some cases, as the time passes, the immunity that has been created might be weakened as well. So that kind of situation, I think we need to know as well. Further, I think it is really important to know how often that we can be reinfected. We do not know such a fact. And also, when we get reinfected later, for example, such as influenza, we get reinfected every year. But I don't think we do not have scientific fact established about in regards to coronavirus. If the reinfection will create a more severe symptom or less severe symptom, I think that should be studied very well. And for, lastly, what does all this mean in terms of the process of development of the vaccine? I think so. There are many questions that we still have to answer with further research.
Of course. Dr. Tan, authorities here in Korea believe that the virus is spread via droplets, but the possibility of aerosol transmission cannot be dismissed within unique environments. First of all, please touch upon the difference between droplet transmission and aerosol transmission for the sake of our viewers, and do tell us a bit about the unique setting that the government has mentioned.
So droplet transmission, aerosol transmission, has to do with the size of the droplets that we're talking about. So when we say droplets, it's greater than 5 micrometers. Aerosols is less than 5 micrometers. But an infected person can produce both droplets and aerosols when they are speaking, shouting, and even just breathing, singing. These droplets can be produced. The special circumstances that we're most concerned about would be one in which an infected person is in an enclosed space with poor ventilation, and there are potentially non-immune people who are in that space, not wearing masks. for a prolonged period of time. Prolonged period of time meaning more than 15 minutes. And so if, we cannot, but these circumstances are avoidable. First, don't linger in a place like that for more than 15 minutes. Avoid going to those places in the first place. And in terms of ventilation, we talked about opening windows and doors for more than 20 minutes twice a day to get fresh air in there to circulate and disperse the viral particles. Those are ways that we can prevent aerosol transmission. However, there are some circumstances where we cannot do that. And in those cases, wearing an N95 mask or a KF94 mask could potentially help, but that's part of a package. Not alone will that prevent infection. We have to make sure we're doing hand hygiene, make sure that we're doing environmental cleaning and disinfection. That has to happen in addition to wearing a mask. We can't just depend on masks alone.
Right. Professor Park, one very quick question to you before we end. A recent poll shows that 6 out of 10 Americans surveyed will not get a COVID-19 vaccine as soon as it is available. How do you respond to this finding?
Yeah, that's very worrisome. The survey that I saw was a third of the Americans will refuse to get vaccinated. So according to one study, in order to achieve safe levels of population level immunity, that's herd immunity, we need a vaccine that's at least 80% effective with at least 75% of people being vaccinated. If only 60% of Americans got the vaccine, then we need a vaccine that's actually 100% protective. Well, the FDA, in an attempt to speed up the vaccine development process, is requiring only 50% effectiveness to be approved by the FDA. So the U.S. will really need to figure out how to increase the number of people that gets vaccinated or hope for a highly effective vaccine, neither of which is very likely at this time.
I see. All right, Professor Park, I'm afraid I'll have to cut our talk short today because of the lack of time. Thank you for joining us virtually. Professor Lee, thank you for being with us today. And Dr. Tan, as always, thank you for your thoughts.
Thank you.
Right, well, that ends our coverage of COVID-19 for this week. Now, given the seasonal transition here in this part of the world, there have been abrupt swings in temperature as of late. So do seek to take better care of your health. In the meantime, have a safe weekend and see you next Monday.